name is Gloria Oluchi Kalu. So Gloria, you're welcome. Thank you for coming on Mental Health Talk with Evelyn again. This is the second time you are coming on this program. I appreciate it. Thank you for having me. Thank you so much. So today we'll be talking about today we'll be talking about suicide and mental health. So last week was the world on the 10th of September was the World Day of Suicide Prevention. So based on that, we'll be talking on suicide and mental health. It is very, very important because I think we have a lot of cases of suicide nowadays, and it's really very alarming. It's something that we really need to watch out for, especially when it has to do with our mental health. So this is what our guest speaker. So Gloria she's a clinical psychologist. She has various trainings on substance abuse treatment, rehabilitation, CBT, anything mental health. Gloria is in. So thank you so much for joining.
Thank you for having me.
You're welcome.
Yeah.
Okay, so we are looking at some of the reasons that would make an individual consider suicide as an easy way out, because for some people they feel suicide is the best option.
Yeah.
So when they don't have any other option, they just opt for suicide. So what could be the reason why people would definitely choose to commit suicide than trying to sort out the issue or trying to solve whatever issue that it is?
Okay, first of all, suicide. I don't want to assume that we all know what suicide means.
Of course.
But okay, you know what suicide is. Suicide basically means someone taking his or her life. That's what suicide is. And people commit suicide for a number of reasons, for so many reasons. Normally, what we hear on social media, what people talk about is, depression. Everybody committing suicide. The first thing that comes to everybody's mind is the person was depressed and the person killed himself. But depression is not only the cause of suicide. Suicide can be caused by a couple of things. There is the mental illness, of which depression is a part of. Of course, people who suffer from maybe schizophrenia, bipolar disorder, people with bipolar disorder, for example, especially when they're in a manic phase, they can actually engage in really self-destructive behavior that can lead to suicide. People who hearing voices, for example, someone who is suffering from schizophrenia can commit suicide. Someone who is depressed because of the lack of hope that comes with depression can also commit suicide. Someone who has anxiety can commit suicide. So these are mental illnesses that could actually lead someone to commit suicide. But apart from these mental illnesses I've talked about, other things that can cause suicide, heartbreak. Of course, we have heard on social media where you say someone's boyfriend broke up with her and then she killed herself.
In fact, I even saw a video very recently on the boy, stabbing himself with a knife.
Okay.
Severally because the girlfriend left him.
Because his girlfriend left
him. So it's that serious.
So for me, I would say that the major cause of suicide is inability to cope with stressful situation.
Okay.
Now in life, we face stressful situations from time to time, so that can be a cause of suicide. So some people do not have the ability to cope with certain stressful events that might go on in their life. So someone has a heartbreak, and the next solution is to commit suicide. There are people who have been abused, either physically, emotionally, or sexually abused, are at risk of committing suicide. People who have been victims of brutality or had a traumatic experience in the past can also have risk of suicide. We also have people who have a loved one or have seen a loved one commit suicide. Can actually also be at risk of suicide. So suicide there are a lot of factors put people at risk of suicide. Anxiety, having sickness, maybe a long time illness or pain that the person has been suffering for a long time. That person might just feel like, I'm done, let me just end it here. So those are a couple of things that predisposes people. Then of course, before I forget, substance abuse. I heard a story of a guy recently that, I think that was earlier in the year, in one of the state's universities or so, that jumped off a 2-story or 3-story building because he was high on substance drugs. Exactly, and he committed suicide. So there are a couple of things that can actually predispose a person or put them at risk of committing suicide.
Wow.
Yeah, not just depression.
Not just depression.
Okay.
Okay, thank you so much. So these factors that you mentioned, is it peculiar to a set of people, a particular age group, or it's a general factors?
Okay, so I think that when it comes to suicide, it cuts across different age bracket. Although in recent times, in research, I read research about in the US about the age bracket. I think I saw one that says people between 10 to 34 years were found to be more likely to commit suicide and all that. I think that maybe the age bracket kind of predisposes them to certain kinds of, it can affect the reason why the person kills himself, but maybe not necessarily suicide itself. Now, someone who, if you look at a teenager or a young adult, the reason why such a person would want to kill himself may be different from the reason why an adult would want to commit suicide. So it cuts across different ages, mostly, but in recent time, research has shown that we find more young adults committing suicide. A lot of things could account for that. Maybe low level of frustration tolerance. I don't know. I personally think that the younger generation we have these days are less likely to tolerate frustration than the older. I don't know what that is, and this is me just saying it hypothetically, okay? But I think it's yes, there's a possibility of that factor in suicide.
Well, I also think sometimes it could be as a result of bad parenting. Because the reason why I said that is because there was a particular time I was listening to a program on a radio station, and this young girl actually called, and she was seriously seeking for help. I think a very young girl, and she was like, she feels like she wants to commit suicide. She just wants to commit suicide and end her life. And it was as a result of the parents not, arguing every time, fighting every time.
Yeah, of course.
So she was just tired of that scenario.
Yeah. Okay, so that's like time. We can classify that as a traumatic event. Okay. Of course, a lot of people commit suicide for financial reasons. Oh, we are having money problems, and that's the reason to. So people, that's why I said that it may not be in the event, but actually in your ability to cope with that event. Because the truth is, I always say that in this world generally, things always happen. Bad things happen to people all the time.
Yeah.
But many people are able to cope with those bad things better than others. Okay. And that's what brings, because for me, the major reason why someone would want to kill himself is because you no longer see hope. There's that lack of hope is no longer there, and you just feel like, what am I living for? Why should, as in, there's no need to live. But as long as there is hope, a person might not necessarily think of killing himself or herself. Okay, so that's why I think it's about age.
Okay, so what could probably be those possible signs to look out for? Because some people, they really just go ahead and commit suicide and they leave a note, and people around them will claim that I don't know that this person wants to, I don't know that this person was actually going to commit suicide or end his or her life. So what are those signs you can look out for anyone that is predisposed to committing suicide?
Okay, first off, I think the warning signs are always there. They are usually there, maybe very subtle, and you may not be able to pick it, but they are usually there. One of them is isolation. When you see someone isolating himself or herself is actually a clear sign of a mental illness. It could be that the person is depressed or suffering from some form of anxiety or something. Yeah. But when you see someone who used to interact with people a lot begin to separate himself or herself and stay on their own, that's something to Worry about, yes. Something is a reason to actually have a conversation with that person to find out why are you isolating yourself, why have you not been interacting. You want to find out, to know what's going on with that person. Because most people, especially young people, teenagers, especially when they are dealing with identity issues, or they have not been able to secure that trust in their parents or guardian, they might not come up straight to you to tell you, this is what I am going through. And of course, for adults, there may be people that are very private people. They don't like to share what's going on with them. So if you notice this person, this friend, this family member that used to interact, and this person suddenly is isolating himself or herself, then that could be a warning sign. That could be something, a need to, that's showing that there's a need to actually engage this person in a conversation. Another thing that could be a warning sign, if someone has attempted to commit suicide in the past, such person you need to put an eye on, because that one is clear that this person has tried this before. Sometimes people try to kill themselves and they are not successful, but you still need to put an eye on this person, because this person may try to do this again. So you need to put an eye on the person. And of course, we have other warning signs: presence of mental illness, substance abuse, which I already said are risk factors for people. And also people who are discriminated. Like, I don't know, research showed that people in the LGBT family, gay and all that, they have high suicide rates, because when they start having a sexual identity crisis, they are being discriminated, of course. People discriminate against people with homosexual behaviors and all. That kind of puts people at risk of suicide because of that discrimination. So those are some of the things. People who are going through difficult things, those can, it doesn't mean that this person is going to commit suicide, but it just says check on this person. It just says let's find out what's going on with this person. Then one other thing is, sometimes people actually give the sign, like someone saying, I'm tired of life. I think you guys will be fine without me. Or saying, I just wish I could sleep and not wake up.
In fact, something as simple as WhatsApp status.
Yes,
it's
exactly.
very important, because sometimes you see some posts on your WhatsApp status, and the person will be like, oh God, I need help, I need this, I need that. Most times people usually just view past it without paying close attention.
Some people actually give subtle signs. They might just be telling you, just be in competition. You can tell that, oh, someone says, man, I'm tired of this life. You want to find out, are you really tired of life? What's going on? You want to find out. Because what happens, I think, is that most times when people make these threats, we don't take it seriously. We just take it like, you don't start again, or this is why I just look for attention. Of course, there are people that I'm going to kill myself as a means to get your attention, but you need to be sure, you need to probe, ask why, what's going on. Say, I feel like I could just disappear. I just want to disappear out of the world. I don't want anybody to see me again. You want to ask this person, why do you want to disappear? I mean, why do you think you should disappear? Or someone says, I'm tired of this life, or if all my problems can just go away, or you need to check and ask questions and find out why this person is saying this, because this could be early warning signs for substance abuse.
Okay, thank you.
Oh, I said substance abuse. Sorry.
For suicide. I know you. Okay, thank you so much. Thank you so much for that. So it's very important to pay close attention to these details, right? It's very important. So when you talk about teenagers and suicide, I think we have a quite number of teenagers committing suicide. So what could be, because as a teenager, if you really look at it, they really do not have much responsibilities. They don't have much responsibilities. You're not paying compared to an adult. So you're not paying school fees, you're not paying house rent, you're not paying NEPA bill, you're not bringing money for food. So what could make a teenager likely to commit suicide, aside from the parental issues and
of course, apart from that, of course, we talked about abuse.
Yeah.
A teenager who is dealing with an abuse situation may not come up to tell you I've been abused and all that, and may just be dealing with all that alone. There is also the case. There is also issues like heartbreak. I mean, boyfriend issues, girlfriend issues.
Okay.
It could also be substance. Yeah, I mean, these days people use substance at really young age. It could also be what was I going to say? It could also be self-esteem issues, identity crisis. Everybody knows that. Well, maybe not everybody, but at teenage years, there's a lot of identity crisis. Who am I?
Yeah.
You know, what's the ideal kind of friends to move with? You know, and especially a child who is being bullied, or you know, there are a lot of all that going on for an adolescent that can cause a lot of confusion for that child and can actually predispose this child to suicide if there are no checks and balances, or if this child is not equipped to know how to deal with these difficult times when they come. And that's why it's very important for teenagers and for children. That's because I like I said earlier, suicide is literally saying that this person doesn't have the ability to cope with stressful life situations. There are stressful life situations, so this child needs to be equipped. This adolescent needs to be equipped with skill on how to deal with some of those things. That means parents needs to be intentional about building certain skill in a child. They need to understand that
coping skills.
Exactly, because the truth is, even as adults, a lot of adults don't even know how to cope with stressful situations. But it's easier when you are able to build that in a child from childhood. You know, for how to tolerate frustration, how to cope with stress. If it's a child that is dealing with self-esteem issues, you want to help that child to build back that self-esteem. You know, those are some of the things that could help to. So when it comes to issues, if the child also has like a trusting environment, I know that I can always talk to my mom, or I know I can always talk to my teacher, or I can always talk to the counselor. It helps me to, as in, I can easily go to someone, so that there's that secured relationship that the child knows that I can always talk to someone. I don't need to deal with this on my own. But if these children come in with these issues and they're not taken seriously, they're not paying attention to their emotion, they might just feel like I'm alone. Right? It's really helping the child to build those skills intentionally. Building those skills in children and adolescents. It can actually go a long way in preventing suicide. Yes.
Well, thank you so much for that. So I have one more question. So for some people, okay, so is it possible for an individual to get out of a suicidal thought himself without help or any professional help?
Well, I don't know. I really can't say, but you would need help. Do not be under pressure to do it on your own. That's what I'll say. Because the truth is, sometimes when we go through stuff, we try to bottle up the things inside. You don't want to share. Honestly, okay, since we're talking about suicide, I've talked about suicide before. I've actually talked about it, but I didn't do it, but I thought about it.
So how did you come out of that situation? Did you speak with a professional? I didn't, or you just came out of it yourself?
No, I didn't come out of it myself. I didn't speak to a professional either. I spoke to some friends. So what happened is I was actually going through a difficult time at that time, and I couldn't think. I was feeling too ashamed to talk to anybody about it because I felt like I was going to be judged about the situation. So I couldn't tell my mom. I couldn't tell anybody at that time. So it was more like I was bottling it up inside for a long time, and then one day, I don't know, that day, sorry, I was not going to do it, please, disclaimer. She would. That day, it just came like a snap in my head that night, like, you know what, just end this thing. Like, what's the point? You know, what's the point? I just end it, and I think I took a knife, so, but then, for some reason, I don't know what helped me was I started thinking about my family. You know, being in Nigeria, and you know that there are a lot of cultural stigmatization against people that commit suicide. So at that point in time, I thought about my family, I thought about my siblings, I thought about my my family. At that point, I snapped and I dropped the knife I was holding and I started crying. And then I called a friend and I opened up to my friend. Thankfully, the friend didn't judge. He didn't, he was there. He spoke to me, and at that point, I said, at that point in time,
sorry, I think there is a call. Okay. Sorry about that.
So at that point in time, I started thinking about the reasons why I needed to leave. And honestly, the reason wasn't a death sentence, like to get to the point. But at that point, I wasn't thinking. And that's why sometimes you need someone outside yourself. Because on your own, you are not thinking straight. Yeah, and what happens when we are in bad situations, most time we focus only on the negative. So you're not thinking about the negative effect of because suicide is not just about you. Understanding that you are not living in isolation.
It's not about you, it's about people around you, your loved one, your family.
Some families never recover from a loved one that committed suicide. Some families never do that. So understanding that it's not just about you. You need to talk to someone to help. You need to talk to someone really, because you don't have to go through the pain on your own. Talk to a professional, talk to friends, talk to their secure environment that, of course, you can talk to someone. I know I'm always careful when we say talk to someone, because sometimes people are judgmental. I mean, people see people that commit suicide as weak people or bad people, or but you need to look for the right channel, the right support system to be able to channel out those emotions and talk about them. So what talking to a professional does for you is that it helps you because the professional is trained. The professional is able to see the faults in what your thinking pattern is able to see where the problem is from, and because the person is talking from outside you, it's not you talking. Someone is watching, is bringing like third view to that. So the person is able to see and able to guide, like, okay, help you to point your direction towards those faulty thinking that you may be having. Because the truth of the matter is that I don't think there's anything worth killing yourself over. Because
there's nothing worth
thinking about it, most times we have really difficult times, but they soon pass away, right? And if you're honest, you will discover that at those times where you're having those really difficult times, you are not seeing the possibility that it is going to be a solution. I mean, it seems like a really bad
problem.
Exactly, it seems like a really bad situation. But the truth is, most times we get through those difficult times. We get through them, and me personally, I ask myself, like, why was I worried? Why was I pitying myself over this issue? And all that. So you don't really need to go through it on your own. But of course, you can always talk to someone, you can always talk to a professional. If you have secure environments, people that you can trust, that wouldn't judge, it's good to talk to them, engage them. Yeah.
Thank you so much. Thank you. You've said a lot. Thank you.
Okay.
So any final word from us before we come?
Final words is, if you have a loved one, or if you have a loved one or a friend or anyone close to you that is going through that has attempted suicide in the past, or that you suspect may be going through a difficulty, you shouldn't come into that person being judgmental or attacking. Because sometimes people say, "Oh, I want to kill myself," and you're like, why do you want to kill yourself? You're not, you can't do that, right? You need to understand that.
You need to empathize.
Exactly. Show empathy. You know that this person is going through a difficult time. If you can't help the person, maybe you should get help from the person. I know personally, there are a lot of therapists out there that you can always talk to. Here in Brazil, we are here for you 24 hours, 7 times a day, for you to talk to as regarding your mental health, as regarding how you're feeling. You don't need to deal with a mental health challenge until it gets to a point where you are now considering suicide. Okay, problems have solution. Problems have solution. And running away from the problem doesn't necessarily solve the problem. And also understanding that when you become suicidal, when you kill yourself, it's not just about you. It affects everyone around you. It affects your family. It affects even people that are not related to you. Because of course, I personally do not like watching suicide videos because it's kind of traumatizing. It's
disturbing.
Yes, it is. Okay, so it doesn't impact just on you, it impacts on a lot of people around you too. And of course, everyone is valuable, and yes, when there's life, there's hope. It sounds cliche, but that's the truth.
That's the truth.
When there's life, you have opportunity to make a change, you have opportunity to grow yourself, you have opportunity to even achieve those things that you think are difficult. But when you kill yourself, you've closed that chapter.
Yeah.
And that's it.
Personally, before it even gets to that point of suicide, people should seek help.
Yes.
Immediately. Before it gets to the point of suicide, that means it has been, going on and on and on. That thought has been coming in, and so just seek help. Suicide is not. It's never an option. It should not be an option. So whatever it is, talk to a professional, like she said. Talk to a professional, or you can. It may not even be a professional. Talking to a friend could help. It could be a religious leader, a trusted family member. As long as you get off that burden, you get it off your mind. So thank you so much, Gloria.
Thank you
for coming on. Okay, so if you have question, let me see. Oh, someone said Lagos traffic can trigger suicide.
Okay. But it's actually funny what things that can actually trigger suicide.
It's funny as it sounds, but if you really look at it, but you should not
Lagosians. By now we should normalize that. But the truth is, it's not you that people they're actually adjusting. People adjust to issues differently.
Yeah.
I mean, I heard about, this is a side joke anyways, I heard about some people in abroad when they take their lives and they want to kill themselves because NEPA take lives. Sorry, they don't have NEPA there, but you can just imagine. But this is something that sorry, except you're living in some other parts of Lagos, these things. But
it's now part of our culture here in Lagos. That's good. You must face traffic, so it shouldn't lead to suicidal thoughts.
But it could for someone who has a very poor coping skill. It could. So it's not in the situation. So the situation the person might be presenting to you to have caused suicide, maybe something you think is actually very little.
Very little.
But because this person is unable to cope with it, it can escalate and become a reason to kill herself. So use coping skill. If you need to talk to someone, one thing I just want to add, is that we need to normalize talking to a therapist. You need to normalize it, because sometimes people think it's only when you are depressed or when you have mental
issues.
Sometimes you can walk in and talk about how you can build coping skill. It's fine. It's fine. Seeing a therapist doesn't mean that you are you have a problem per se. Let me use that word. You have a problem. It's just saying that you are interested in building your mental health. Take care of your mental health. It's very important. We can't overemphasize the need for you to take care of your mental health. Stress, overly being stressed can actually lead to that. So there are a lot of things. The factors are a lot, and it differs for individual. It's just understanding yourself.
Thank you so much.
Thank you.
So if you have any other question, you can drop it in the comment section. Then we'll definitely see them and attend to them. So thank you for joining in today's session. So you can watch our previous videos on mental health talk with Evelyn on our YouTube channel. Just go to Grace Hill Behavioral Health Services on YouTube. Then you see our previous videos. We have a lot of videos there, and we have a lot of mental health talk with Evelyn sessions that we've done. Previously, so you can just watch our previous videos. So we have love and mental health. We have question and answers with Dr. Idebi. So join me next week. Next week we'll be talking on a very important topic, and it is managing a mentally ill relative. I'm sure you don't want to miss. You don't want to miss that topic. It's something that everybody should know. It's very, very important you know that. So thank you so much. Join me next week on this same platform, Wednesday 3 p.m. Thank you. See you and have a nice day. Bye bye.